Today, prospective parents have many options available to them regarding the birth of their baby. These options include various methods of pain relief to make labor and delivery more comfortable. One of these methods is called epidural anesthesia. Epidural anesthesia is a type of regional anesthesia. This means it blocks pain sensations in a large area of the body. Epidural anesthesia may be used for vaginal births and for both planned and unplanned cesarean births. Although epidural anesthesia can be offered to most women, there are a few conditions that may prevent its use. These include bleeding disorders, nervous system disorders, skin infection of the lower back, previous back surgery, or spinal abnormalities. If you have any of these conditions, discuss it with your doctor. Epidural anesthesia can be used throughout most of labor and delivery. The point during labor when the anesthesia may be started will vary according to the situation. Your doctor will discuss this with you. Before starting an epidural, certain preparations are made. If an IV is not already in place, one will be started in order to provide fluids and medications if necessary. A fetal monitor will also probably be used to keep track of the baby's heart rate and your contractions. You'll be asked to sit up or lie on your side and to hold your position as well as you can. First, your lower back will be cleansed with an antiseptic solution. A local anesthetic will be injected to numb the area where the epidural needle will be inserted.
Now, the next thing you're going to feel is a little pinch of the numbing medication. Okay, a little pinch and a burn. Here we go.
The epidural needle is then inserted.
Now, at this point, you may feel a little pressure.
You may feel pressure during the placement of the needle, but any discomfort you feel is generally much less than the pain of a contraction. The needle is placed into an area called the epidural space, which is just outside the sac that contains spinal fluid. The spinal cord itself does not extend down as far as the needle site, so there is no risk of touching it. After the needle is in place, a thin, flexible tube called a catheter is threaded through it. The needle is then removed.
Okay. Now we're going to get this hooked up. I'll be putting first little bit of local anesthetic in place in just a moment, what we call the test dose.
Right. The anesthesiologist will give a test dose of medication to make sure the catheter is in the proper position.
Now, as we give this test dose, you may feel a little coolness or a little pressure in your back. Elizabeth's going to be checking your pulse. Everything went very smoothly, no problems.
I just felt some pressure, that's it.
Okay. And I'll be putting the rest of the medication in over the next few minutes here.
Contraction.
Deep breath in.
The catheter will be taped into place so that it won't pull out. Pain medication can then be injected through the catheter in intermittent doses, or it may be connected to a pump that delivers a continuous flow of medication. Once the anesthesia takes effect, pain from the contractions will decrease significantly. Usually, you will still have some awareness of your contractions. This may be helpful during the pushing stage of labor. While receiving epidural anesthesia, your blood pressure and other vital signs will be monitored. A urinary catheter may also be inserted to drain your bladder. You can expect to spend the rest of your labor in bed. You will still be able to move your legs, but they may feel heavy and partially numb. When it's time to push the baby down the birth canal, you may be able to push effectively on your own, or with the assistance of the nurse or labor partner. In some cases, the medication may be adjusted in order to help you push more effectively. In the event that a forceps delivery or a cesarean birth becomes necessary for medical reasons, sufficient anesthesia can be given through the epidural catheter. For a cesarean birth, enough medication is given to numb the body from the chest down. During a cesarean, you may feel pressure at times, but you will not be uncomfortable. As with any medication used during labor and delivery, side effects may occur with the use of epidural anesthesia. The mother may experience low blood pressure. Labor may slow down temporarily. In rare cases, the mother may experience headache after delivery, or the epidural may not provide complete pain relief. It may be spotty or patchy. Extremely rare risks include injection of the medication into a blood vessel, which could lead to seizure, or injection of the medication into the spinal sac, which could lead to a level of anesthesia that interferes with breathing. Epidural anesthesia also has many benefits. Because it is delivered into the epidural space instead of the bloodstream, the baby is exposed to very little medication. It provides good pain relief while allowing the mother to remain alert and participate fully in the birth. And it can be adjusted to accommodate any special situations that arise. Every labor and delivery experience is different. Epidural anesthesia is one of the options available to help meet your special needs.